I mentioned Alzheimer's disease earlier. Which neurotransmitter affects Alzheimer's disease? Which one? The ACH, acetylcholine. Very good. With hint. Not with dementia, but with Alzheimer's disease. We'll talk about dementia for just a moment. So dementia is just a deterioration of the intelligent function, mental skills that the patient needs for daily living. So I forgot where I parked my car. Oh. Usually this happens, this can occur at any age, but typically this happens at older age, but again it can occur at any age, especially if there's some type of injury or the patient has had hypoxia at some time in their life where their brain was deprived of oxygen. But usually this occurs in the elderly. Antipsychotic drugs is a major treatment for the different disorders, and all we're doing here is affecting the neurotransmitter somehow. We're either blocking it or we're telling it to produce more. So we're about to go into the different drugs. So all we're doing is blocking it or we're telling it to produce more. When I say blocking it, we're blocking the reuptake. I guess I need to be more specific on that. Mark this slide off. If you are on page 58, I've listed some up here, some of the more common ones, but these medications are used to treat schizophrenia, you don't have to learn the brand and generic, just remember a couple of those. I could give you a scenario where I say the patient is diagnosed with schizophrenia. Give me an example of a medication you would put the patient on. So table 4.1. Is everybody with me? Let's look over on, so go ahead and pick, I don't know, maybe two that is your favorite and highlight either brand or generic, it doesn't matter. Let's take a look on page 59, adverse effects of the medications that we just looked at on table 4-1. As you can see, there's a lot of side effects. You'll see these side effects associated with a lot of different medications, not just with the psychotropic medications. For example, dry mouth, blurry vision, urinary retention. We'll see this with a lot of medications, especially medications, those particular ones, especially with medications that affect acetylcholine. You don't need to write that down per se. But what I just want to point out is that some of these side effects are not associated with just this particular group of medications. Sedation, headache, behavioral changes, these are potentially common side effects of other medications as well. A couple that I want you to maybe underline or make note of, just in general, sedation, and hypotension. Here it is mentioned as orthostatic hypotension, and just to tell you what that is, but you can just put hypotension, but I'll go ahead and tell you what is meant by orthostatic hypotension. When you're sitting down or laying down and you stand up too quickly and you kind of get dizzy, has that ever happened before? That is called orthostatic hypotension. But for memorization for a future quiz or midterm, you don't have to put orthostatic hypotension. You can simply just put hypotension. Okay? So if I ask you, give me a couple adverse effects of the medication, you can list any of these are acceptable. I mentioned just a couple of the main ones associated with this class of drugs. Is everybody with me? Okay. Now we're talking about the mood-altering drugs. Here we're talking about a patient with that is bipolar or manic depressant. And we'll be looking at a few different drugs associated with this. Lithium. The note here is that the drug of choice. Now, drug of choice is I would say is more Depakote or valproic acid is the generic. Lithium is still a good choice, but the therapeutic. Remember when in chapter 3 we looked at the therapeutic range. There is a very narrow therapeutic range with lithium. So it's easy to go into the toxic level with lithium. It works well, but Depakote is also a good drug that is used for bipolar. Depakote is also used to treat something else. Any guesses? Seizures. Very good. Used to prevent seizures. For side effects, a couple that I want to mention with lithium. On page 60, adverse effects, about middle way on the page. If you will highlight or underline the lithium-induced tremors. That is one that I want you to remember. Last sentence on adverse effects. And also, they use the word fatigue, but if you want to put drowsy, that's acceptable as well, or lethargic, that's acceptable as well, or fatigue, all those is acceptable. Okay. Now we're going to the antidepressants. I'm going to spend most of our time on antidepressants now. Most of our 5 minutes that's left. So with antidepressants, we have a couple different categories. tricyclic antidepressants and selective serotonin reuptake inhibitors are probably the two most common. We'll be spending most of our time on the selective serotonin reuptake inhibitors. Our monoamine oxidase inhibitors, MAOIs, we will spend very little time on. I will simply mention them, but I'm not going to spend a lot of time on it because they're rarely used anymore. If you noticed on over-the-counter medications, it may say if you're taking a MAOI inhibitor to consult your pharmacist or physician. We'll talk about that because we're affecting multiple neurotransmitters with that. And just like when we hit multiple receptors, we get multiple side effects. So a ton of side effects associated with that. And then atypical antidepressant drugs, we'll be going over those as well. And I think that's a good place to stop the video.